Good evening, everyone, and welcome to the Town Hall meeting series from the Healthcare Agency of the Orange County. Tonight, we will talk and learn about the COVID 19 vaccine and the county efforts to assist our most vulnerable seniors and the Latino community. I will introduce our panelists, Vice Chairman Doug Chaffee and Dr. Clayton Chau. Vice Chairman represents District 4 of the Orange County. Going back to Dr. Clayton Chau, Director and County Health Officer of the Healthcare Agency. And we're going to start with Vice Chairman Chaffee.
Thank you, Mr. Placentia. We're going to talk about the different kinds of pods this evening, especially the mobile pods. The pod is not something that you store things in, rather it's an acronym, it stands for a point of dispensing. And we have rolled out already what we call super pods that can vaccinate in a day's time thousands of people. We also have rolled out what we call medium pods that are more focused. We have an example of that now just opening up in Santa Ana Community College to have a special purpose. And we also have what we call mobile pods, which is more the focus of what we're talking about this evening. All the pods are under the management we call an incident management team. They make certain all the pods are staffed, the reservations are in, and that the various things that you need at the sites are there. I found it very interesting when I and my staff were volunteering at a mobile pod, how they were set up. At the end of the day, they put everything back in the truck, roll it back to a secure site, and restock the truck with everything they need for the next day, including lunches for the people working. And then they roll it out the very next day. So if I may, I'd like to ask Martin Placentia, if I may ask you a question. We've learned over the past several months how critical it is to have effective community outreach, particularly within our minority communities who have been disproportionately affected by COVID-19. Martin, tonight's town hall is an example of these outreach efforts, but can you tell us about the other ways we're trying to connect with all groups?
Of course, Vice Chairman Chaffee. County efforts begin with supporting the Latino community, and strategies are under development for other minority groups in Orange County. Right now, I am working in the Office of Communications to provide information and languages for Spanish-speaking community members as much as possible. For example, Latina.com is offering information in Spanish to register for vaccination and has just started. To offer the information in Vietnamese and other languages are coming. We are sharing news updates with the latest on the COVID-19 vaccine on social media, all in Spanish. All forms and written materials that people will receive during the vaccination process are already in Spanish. We are producing audio recordings and video in Spanish, highlighting COVID-19 vaccine availability and its impact in the community. Recently, we just produced a video describing the process people has to follow when they go to get the vaccines at Soca University in Aliso Viejo, and we are planning to do similar videos for the other pods and super pods. Now we are developing a strong partnership with the Spanish language media for outreach. We have constant contact with the Spanish language media, passing on vital information to our Latino community and doing interviews with messages and campaigns to promote registration among seniors like never before. We are partnering with community-based organizations. A list of community organizations with great influence and connections in the community has been established. These are local groups that understand the community and are trusted by the community. The goal is to let them know that the county has a person who speaks their language and that we are here to provide them with the information and resources that the county has for them. So we are working very hard to make sure that no one in Orange County is left without information in their native language. We will now turn to Dr. Chau, Vice Chairman Chaffee, who will talk to us about the mobile pods or mobile vaccination units.
Well, thank you so much, Martin. I appreciate your kind words and direction. Dr. Chau, the county is doing everything to expand its reach and vaccinate as many individuals as possible. Our primary goal is to prioritize the most vulnerable populations, such as the Latino population and our seniors, and those that are not able to make it to the SuperPod site. Can you tell us some of the unique efforts to roll out and expand vaccinations throughout the county?
Yes, thank you. Good evening, everyone. Thank you, Martin and Vice Chair Chaffee for allowing us this opportunity to have a discussion around what we're doing for the community as is related to vaccine. And so, as you mentioned earlier, Vice Chair Chaffee, there's various ways that we have been trying to offer the vaccine to our community. And we do understand that there are sites where our community cannot go to for one reason or the other. It could be barrier due to transportation. It could be barrier due to language. And Martine already talked about how we outreach into individual in their own language to help them get access to the vaccine. But one of the important efforts that we have been doing here in Orange County is bringing a pod to the community, to the neighborhood, to area that we know there are vulnerable seniors, because at this time we are vaccinating seniors 65 and older. We want to make sure that seniors have a way to have access to the vaccine that is equitable. We are using our mobile pod to outreach to seniors in the lowest social economic area where there's high positivity rate for COVID-19. And then we want to make sure that we align with this guidance on ensuring that the people who live in our lowest quartile of socioeconomic status have access to the vaccine. So that have been our effort. The other thing that you mentioned earlier, Vice Chair Chaffee, is we stood up the medium pod at the Santa Ana College campus and targeting individuals who live in mainly Santa Ana, Anaheim, and Garden Grove area. And next week, we will be working with OCTA as well as APRADA to bring the senior who have difficulty with transportation directly to the site. So.
Well, thank you so much for that great information. I understand that the information continues to change, and sometimes very frustrating. And it can be difficult to stay on top of it. I appreciate how adroitly you've been able to do that. It's a dynamic disease that we're just beginning to wrap our arms around. Can you, Dr. Chau, tell us the latest information about COVID-19 to help us stay as current as possible? There are some variations coming out there in what the vaccine supply is and that kind of thing.
Yes, sir. So the most important thing is, I think, people are frustrated because we don't have enough vaccine allocated to our county. And it's not just our county. I mean, this is for all counties. The demand is higher than the number of people. The demand is really higher than the number of vaccines that is available. And so, as you see on this slide here, we are vaccinating people who are part of phase 1A. Those are healthcare workers and critical workers. We also vaccinate individuals over the age of 65. Now, if you look at Othina, which is the platform that we have developed, there have been over 650,000 people who were enrolled in Othina, but we also been able to have enough vaccine to vaccinate close to about 200,000. So clearly, there is a shortage of the vaccine, right? That's very important. The other issue that you alluded to is that we do know that there are several a variant of the COVID-19 virus that is isolated and found here in the state of California. What it means is these variants are very contagious, meaning it spread very quickly. And so the word is really people should continue to, when they're outside of their home, wear their face mask, stay 6 feet apart from individuals that don't live in the same household with them, continue to wash their hands frequently, cough into their elbow, all those measures that help us to prevent the spread of COVID since the beginning. We must continue. We know that the vaccine that we have currently are quite effective in preventing sickness from the variant at this point. And so that's good news. And so what we're wishing for is to really get more vaccine from the federal to the state to come down to Orange County so we can put it in arms for those who want it. So the demand is higher than the number of vaccine that are allotted, which is a good headache to have. So I'm hopeful that within a few weeks, there will be more vaccine allocated to Orange County.
Well, thank you. That is indeed the hope. And some of it has to do with perhaps another kind of manufacturer coming out, Johnson & Johnson, which can be a game changer when that comes out, because it takes only one shot. You know, we're seeing more and more about the vaccine process, especially with President Biden taking charge and rolling out some things that we badly need. What can people expect when they try to sign up and receive the vaccine? Now we're talking a little bit about Othina and the process you go through, because we don't vaccinate people without a reservation.
Right. So what we like to do is encourage people to sign on to Othina. As Martin pointed out, Othina now is available fully in Spanish as well as Vietnamese, and we are waiting to upload Korean and Chinese in the matter of a week or so. So I encourage people to enroll, because once you enroll in Othina, what we'll do is we'll assign you a time slot to sign up for appointment. And then if everything is pre-registered and you get to the site, the process is very, very quick. You could be showing up to the right time for your appointment, and then by the time you're done with the vaccine and being observed for 15 minutes, which is required, and get ready to go home, it could be a matter of 45 to 50 minutes. So that's very, very fast. So I encourage people to do so, is to really go on Othina and get yourself enrolled.
Thank you for that. It also tracks when you can get your second shot.
That's correct.
And, you'll get an email on that and help get a reservation slot. I might add that Othina is a special app developed for the county. And we looked at Greek mythology and found Athena, who is the Greek goddess of wisdom and war. So both of those seem to fit with what we're trying to do to win the battle here with some intelligence. So during the pandemic, you know, we're all experiencing hardships, and it's really disrupting everyone's lives. I'm still amazed at the giving spirit of our community. Many have asked how they can help, or what they can do to encourage more people to get vaccinated. I know the county is offering some opportunities to get involved. Can you tell us exactly what type of volunteers you need and how they can sign up to help?
Yes, so people can volunteer. I know there's a slide coming up there if people could show. We do need people to volunteer with us. Sorry, I'm hearing a lot of background noise there. There's a website that people could contact to get volunteer. But if not, what they can do is call 714-834-2000. They can be directed. Oh, here we go. oneoc.org is where they can get registered to be volunteer. And if there's an issue with that, you can call 714-834-3000 be directed to sign up for volunteer as well.
Well, please, Mark, go ahead.
That later in our transmission, we will have some questions from the audience that will be answered by either Dr. Chau or by Vice Chairman Chaffee. Go ahead, Vice Chairman.
And you also, I think, if you get the right question. So, you know, there are a lot of myths out there about COVID-19 vaccines. Dr. Chau, can you help us set the record straight by dispelling these myths and providing us with the facts to make us an informed decision about the vaccines for ourselves and our families?
Thank you. Thank you. One of the number one myth is that this two vaccine was authorized so quickly. Actually, the FDA, the Federal Food Administration, that approved or authorized medical product in the United States is one of the strictest entity in the world in their approval process. And so the two vaccines that are currently available, the Pfizer and Moderna, actually went through rigorous a pilot study. And because people all over the world being affected by the pandemic, so many people wanted to volunteer to get enrolled in the clinical trial. So within a very short time, both platform, I call them vaccine platform, were able to enroll well over 73,000 individuals in their clinical trial in order to speed up the process. Usually, for a drug that need to be tested, it takes them a long time to recruit people to participate in the clinical trial. But because of the seriousness of the pandemic, many people want to participate. And so the two companies that make this vaccine were able to complete the clinical trial in a very short time, right? I'll give you a context. Many people are afraid that, well, are these vaccines effective? Well, the regular seasonal flu vaccine that we all get every year, at most, is 60 to 65% effective. Both of these vaccines, a week out after you finish your second dose, is about 94 to 95% effective, right? And then there's some people who worry about, well, these are the mRNA vaccine. Is it safe? Does it change your DNA? It doesn't. I mean, these technologies have been studied by scientists for over 2 decades, and there's a lot of data on speaking how it's safe. But because this mRNA is very fragile, it needs to be stored at minus 90-degree freezer. And that's why, unless for a condition like COVID, regular flu, this kind of storage is not practical. But because of the seriousness of COVID-19, they're moving forward with producing this vaccine. Very difficult to handle. You have to be very careful, otherwise you will destroy it, right? And that's why I think it's very safe. People shouldn't worry, okay? Then the other thing is the question about, can the vaccine be mandated? By law, FDA said any product that is not approved but only authorized for emergency use, a person cannot be required to take it. And so currently, it is not a mandate for the vaccine. But we encourage people to really get the vaccine, because the alternative to the vaccine is, as we have seen this last year, is a lockdown, because people get infected, and then vulnerable people are at risk of dying from the COVID-19, particularly individuals who are senior in our community, as well as individuals who have chronic health conditions.
Well, thank you for that. I wonder, Dr. Chau, if you could explain the state system where we have a purple, a red, orange, and yellow designated for different counties. We're currently in purple, which is the most infected color we can have, and what metrics we need to achieve to get out of purple into red and on up and improve and get things open.
Right. So the state has developed what they call a blueprint for safe, opening safe economy, and it has 4 different colors: purple, red, orange, and yellow. So purple is the most restricted tier. So there are a set of metrics that a county must meet in order to move from the strictest to the less strict tier. So let's say you're in purple, you need to move to red, you have to meet certain metrics. And the 3 metrics that currently the state that really look at to assign a county to a tier are the positivity rate, so the overall county positivity rate. The second metric is the case rate per 100,000, right? And so those are the 2 metrics. And then the state also added a third metric, and the state call it the equity metric. And that metric is basically the overall positivity rate in your lowest SDS quartile, socioeconomic status quartile in your county. So in Orange County, the lowest quartile happened to be inclusive of zip codes in the city of Santana, mainly Santana and Anaheim, part of Garden Grove, and some other area. And so the state expected that that metric also have to be in a red tier or in the same color tier as the other 2 metrics in order for us to move to the next lowest tier. So this last 4 days, Orange County overall positivity rate has been in a red tier. However, our case rates still remain in purple tier, and our positivity rate in the lowest quartile, the equity metric, is still in purple tier. Although we have been able to show that those 2 metrics continue to drop. So I am hopeful that within a month or 6 weeks, we will be eligible to move to the next less restricted tier, which is the red tier.
Yeah, thank you. That's kind of complicated, but it points out how all of us must come together to improve these metrics so we can move forward and alleviate a lot of the economic hardships that we're all seeing. I'd like to now ask a little bit about schools and their reopening. That's kind of an interesting question because the county itself has some 28 different school districts, all governed by separate elected boards. I know they have some things in common. One, they all want to get back to, personal learning as soon as they can, so students can get the quality of education they need and also the social experience. Yet at the same time, they're all concerned about keeping their teachers and staff safe. Can Dr. Chau, can you update us on any of that sort of metric and how schools are coming along toward reopening?
Yes, so you remember Vice Chair Chaffee, prior to the first lockdown in December, a significant number of schools in Orange County was in the process, and also some have completed reopen for in-person instruction, with limited number, of course. Majority of the school districts were in a hybrid, being part of the days or part of the class in person education, and the other part is online, and then they switch just because of the requirement of physical distancing for each of the classroom. Then we went into the lockdown, and everybody had to go into the online learning. However, for any school that had reopened before the lockdown, they are able to continue to bring students back in the purple tier. The state has just issued a new guidance to guide schools that have not reopened, and there are specific metrics that the school have to abide to, meaning there have to be a plan for safely reopen the school, and that plan has to be posted, and then that plan has to be approved by the state. And so I know many schools are working on it. One of the way that we are working with the school is help them prepare for those who have not reopened on how to reopen safely. So I have a call with the public school district on a weekly basis, and then OCDE is facilitating that conversation. OCDE also supports us in facilitating a conversation with the private school as well as charter school as well. And so progress is made. We understand that any family are anxious to bring their student back, but most of the opening has to be based on the local geographical positivity rate as well as case rate. And we have published those data on our dashboard, info.com/forward COVID-19 is on our website. So I invite the public to really take a look at that. All the numbers are posted by a zip code. So it's important for the family to follow, and really have to work with the school, right? I encourage parents work with school, work with teachers, work with the school board to make the most appropriate decision for that geographical area. So.
Well, thank you for that. The school demographics do vary from district to district, so the
That's
plan
right.
can be a little different, and also the timing of them might well be different too. So I think that the county, we want to help school districts any way we can. It's so important that we have our schools open. It impacts so many different lives. If I may, I'd kind of like to turn this back over to Martin. I've been asking a lot of questions, but I think people in the audience should have a chance to do that too. So Martin, take it away.
Yes, we have several questions. We getting questions from the people that is listening. Before we go to the questions, I just we want to thank the city of Huntington Beach for providing resources and organize this town hall series. Thanks to the city council for their support. And one of the questions that we received has to do with educators. And when will the county allow teachers to become vaccinated?
Yes, so I think beginning next week, we should be able to get the educator to be vaccinated. Now, I want to remind folks that for educators who are over the age of 65, they have been qualified to enroll and get vaccinated. So hopefully next week, because up until now, the vaccine allocation to the county is only for healthcare providers as well as seniors, the age of 65 and older. So.
The next question that we have is, what about the developmentally disabled community? They will also benefit from mobile pods or drive-through pods?
So we are working very closely with the Orange County Regional Center to plan out on how we vaccinate individuals who are a member of the regional center, people with developmental delay, once they are eligible to be vaccinated.
The following question also has to do with schools. Will OC Health give school sites assistance and promote vaccines be given to teachers and school staff? I think you already mentioned something like that.
Yeah, we're working with Orange County Department of Education and all of the school district superintendents on that. Yes.
Thank you, Dr. Chau. The next one is, can I stop taking COVID-19 precautions after I am vaccinated?
That's a very important question. Whoever asked that question, I thank you. And the answer is no, not now. Because in order for us to go back to near normal with not taking all these precautions about wearing masks and keeping distance, we have to reach herd immunity in the community. By that, I mean a large number of our community must have had the vaccine in order for us to safely to go without the mask, right? Because even though you are completely vaccinated, but other people are not, you might still be able to spread COVID-19 to them, right? The vaccine is to help us from getting sick, from having any symptoms. But as science knows now, even people who are vaccinated could, I'm going to say could, get infected. You might not feel it, you might not even know it, but you could get infected, no symptom, not sick, and inadvertently give it to your neighbor, give it to your friend who have not been vaccinated just because you're not wearing the mask. So it is very important that because the number of people who get vaccinated in our community is still very small because we don't have enough vaccine. So for those of you who've been vaccinated because you're 65 and older and you got the appointment, or because you're a healthcare provider, you must continue to wear a mask. You must continue to stay 6 feet apart from strangers. You must not gather with people who you don't know and who you don't live under the same roof with. Okay?
The next question is, if I get the vaccine, but I am exposed to a person with the virus, do I still need to quarantine?
So that's a very good question. The state just issued guidance that people who get vaccinated might not need to be quarantined. Yes.
The next one is, can you tell me more about the CDC's guidelines to double mask?
Yes, so the CDC just recently issued guidelines, recommendation, not guidelines, remember guidelines, recommendation on double mask. The state of California has not made that decision yet. Basically, if we believe that if you wear your mask properly, is much better than if you have two masks and then you keep struggling and trying to fit them and moving around and touch it and what have you. That is absolutely more risky than just wearing one mask properly. And so that is the advice I'm giving people is right now, make sure you wear a mask properly, okay? I'd rather you do that than struggling with two masks and not wearing it right and keep having to adjust it constantly. That is much more risky, okay?
Perfect. Next one, if an OC resident already received both vaccine doses and travels by air to another state afterwards, is he required to provide a negative PCR test before getting on the return flight or quarantine upon arrival?
So currently, we do not require people who have been vaccinated to quarantine on return, but I don't know the state where you go to is what is required over there. So you must check with the other places where you're going.
Thank you. How many times can someone get the same virus until they are immune?
That's a good question. We do know that once you get the virus, your immune system develops antibodies against it. We do know that people get protected, develop immunity, but we don't know how long it lasts because we do have people who get reinfected. So that is something that science continue to learn, right?
Perfect. Thank you, doctor. Thank you. We have a lot of questions, so I'm glad that we still have like a half an hour. The next one is, what should I do if I need technical help with Athena?
So I would say call 714-834-2000, and then we'll link to people who can support you.
Perfect. The next one is, can parents of medically fragile children qualify for the vaccine to protect themselves and their children? How do they go about providing evidence of their situation through Athena so they can make an appointment?
So currently you can register on Athena, but we are only inviting people who meet the criteria, and those are healthcare providers as well as those who are senior over the age of 65, because those are the people who currently qualify for it, okay?
For the Athena app?
Yes, absolutely. Part of the requirement for the developer to work with us is there is strict security, meaning there's no leak on the information you provide to us. The app developer is somebody who worked very closely with the Department of Homeland Security, as well as Department of Justice, and with the VA. So they are very familiar with protected security in terms of individual information.
The next one is law enforcement allowed to get the vaccine?
So currently in our county, law enforcement who work in high-risk area where there's high positivity rate, we have been inviting those law enforcement for their vaccination. Sorry. The light went off there.
Okay, the next one is when should high school students expect to be able to play games again?
Yes, so I was just off on a call with this. This is about youth sport, and we are looking forward to the state making announcement within the next few days about youth sport. But for those of you parents who are interested, on the state website, it clearly speaks to under each tier what sport can be allowed to play. So that is very apparent on CDPH website, or you can go to California COVID.gov website and look at the blueprint. It clearly spelled out which sport is allowed under which college tier.
Thank you, Dr. Chau. Othina doesn't ask if you meet certain criteria to get the vaccines, for example, medical conditions, teachers, etc. Would that feature eventually be available?
Yes, we are working on that because the person who asked the question probably already know that the state just over the last weekend made the announcement that starting March 15,
Sure, schools and preschools are following.
You can look up those conditions on the CDC website, but very soon we will share with you what are the conditions. Basically, people with cancer, history of cancer, people who have immunosuppressant medication, like received medication for organ with HIV, people with Down syndrome, people who are obese, people who have type 2 diabetes. So there's a list of conditions that will be issued.
The next question is, how do you ensure schools and preschools are following mask mandates and other health precautions?
So we work with the school. Remember earlier I mentioned on the safety plan that most schools have to post. And so you can look up on the school website, they attest to it. And if they're not following it, you can file a complaint to the state. You can file a complaint to Cal OSHA. And I don't know if we have a slide on Cal OSHA a phone number, but you can Google it. There is regional Cal OSHA office information phone call that you can call and complain if you find out that there is a school that's violating the mask order.
We have another question. It has to do with schools too. Catholic elementary schools have been open since September without any problems. Why cannot all public schools open?
Don't make that decision. That's up to the State Department of Public Health.
Thank you. Next one is, when will the severely ill between 16 and 65 years old be able to get a vaccine?
So as I mentioned earlier, the state will include those folks in the eligibility list starting March 15th.
Thank you. When will the group of people under 65 with no comorbidities will be eligible for the vaccine?
They have been eligible, but the issue is because we have very limited vaccine that I know a lot more folks who are eligible have not been able to get the vaccine. I think I mentioned earlier, the group of 65 and older in Orange County, we are the second largest county with that demographic. So in Orange County, the over 500,000 of individuals in Orange County who are of the age of 65 and older. But every week, there's very small amount of vaccine allocated to Orange County. At most, 32 to 38,000 doses. Just today, for the very first time, we hit 40,000 doses. But that is a 5-digit versus a 6-digit number. So we know people want the vaccine, and we are happy that people want the vaccine. But I'm asking the community to be patient because we just don't have enough vaccine.
Thank you. By the way, Vice Chairman Chaffee and Dr. Chau, we also have a good note, a thank you note. I had from someone that said, I had a terrific experience at the Disneyland pod. So the next question is, will Athena be offered in Arabic and Farsi?
Not Arabic and Farsi. That would be something that we can look into. But I actually want to ask Vice Chair Chaffee to talk about his experience, because I know he's been to the Super Pod and he sponsored the mobile pod. Your experience, Vice Chair Chaffee?
Well, it's been an excellent experience. In fact, it's uplifting. The people that go through, they're so glad to get their shots, and we try to get them through quickly. I know these smaller pod we did, mainly for elderly, that as time they arrived, we got them through the registration process, got them their shot, and they stayed for 15 minutes. The whole thing took somewhere with 30 to 40 minutes. We really got them through. And encourage them, if you have a good experience, share that in your community. There's other people that may be hesitant that need it, are not going to do it if they feel some reason for being hesitant. So I think the good experience is an important thing to share whenever you can. I have my staff there as well. I have bilingual speakers on my staff, which is helpful. And I really appreciate the turnout of people that we have to make this work. I might mention that our incident management team is responsible for staffing all of the different kinds of pods we have. It takes, for example, about 150 people for the right categories to run a super pod, fewer numbers to run a smaller pod, but it takes a lot of effort. And in the mobile pods, we do have a transportation element where through Abrazar and now I think Orange County Transportation Authority, we're providing some mini buses to help reach out beyond where the pod itself is administering the doses. So, and it's a good experience. The people that volunteer, they find it refreshing in this time of a lot of depression to see the good things happening.
Yeah, I know you volunteer a lot, Chair Chaffee, and I think you're right. At these mobile pods, we're able to see the senior who are vulnerable. Many of them are on wheelchairs that are able to get the vaccine because the environment is smaller. It's not as big and overwhelming as Soka University and Disneyland. I know I do see individual seniors who come to those super pods and they get really excited as well that they got the vaccine. And I know for people who get the vaccine, the process is very smooth for majority of them. But I do know that there are people who are frustrated because they couldn't get an appointment. And someone liken it to like winning the lottery. I don't know if I want to view it that way, but for me, is the hardest thing for physicians is to not able to meet the needs and the demand from the community. So I'm hoping one day soon that we have plenty of vaccine. That the only headache that we will have then will be trying to convince those who are hesitant that give them the right information, give them the correct information, not rumors, not stuff that they read on the internet, so they can make a consent to choice in how to get vaccinated. And and what to expect with the vaccine, etc. So Martina, thank you for doing that piece with the Latin community. Latinx community is very important, right? I mean, very important for somebody to really get that information from folks who speak the same language. And so Vice Chair Chaffee and Supervisor Doe, who are part of the vaccine and testing ad hoc committee early on last year, worked closely with healthcare agency, and we started the testing initiative to outreach to the Latinx community and the API community. I mean, early on, and so we have a collaborative of all of the Latinx services provider, such as Latino Health Access and the school district and the other community-based organizations, as well as community clinic. I mean, this effort in focusing on where the vulnerable population are and getting not only testing, but also vaccine to them. So I appreciate the support.
Well, thank you. We appreciate your work, really.
Actually, Valero, I mean, it's a good opportunity to work like what I'm doing right now, trying to work with the Latino community and inform them and tell them that there's someone there and that the county and the different districts like Vice Chairman Chaffee district, that there's someone they can speak their language, because I'm sure this question is for you, Vice Chairman Chaffee. You represent a big district with a lot of ethnic groups. I'm sure, do you get a lot of calls from people trying to get information and directions about how to do in the process of the vaccination process?
Yes, we do. We try to get them whatever help we can, but it also need to direct them to the hotline where they can get additional help. I might add that what we've been doing with some of the smaller pods, where you get the mobile pods, where you get more personal attention. If we have your name and phone number, we take, or some other way of communicating with you, we take down what information we can. We input some of that for you when you arrive, if you're struggling with that. And the additional language support we have at the mobile pods is very helpful to get people in there. We try to vaccinate on the basis of reservation. We do check off the list. If they're not there, we call. Did you forget? As a reminder, or if you're not coming, we have a wait list that we put people in to try and get them there quickly to take that spot.
I want to take this opportunity, Martin, to say two things. The first thing is that we have started to hear that there are people who bad character preying on the community, especially our communities that have limited English proficiency, right? Nobody should be calling you and telling you that they will sell you the vaccine, will sell you an appointment for a slot to get the vaccine. Nobody should be calling you and asking for your credit card number. The vaccine is free. Let me repeat that. The vaccine is free. So if any character calling you up and want your information, want your social security number, want a credit card, want a money, I want you to report it to the DA's office. Number for you to report fraud is 714-834-3482. Let me repeat it again. 714-834-3482. Okay? Everybody qualify for the vaccine. The only reason why we ask you to show proof that you live in Orange County is because the vaccine is allocated to Orange County for people who are in Orange County. That's it. No other reason beside that, okay? So you should not be afraid that somebody will report you or somebody will get you in trouble. None of that. We want to make sure that most vulnerable people who are easily preyed on, understand that the vaccine is free. Nobody should pay for it. Nobody should get you to give them any information. You shouldn't buy any vaccine. You should not buy any appointment. You should not buy any slot. It is absolutely free. Okay. The only reason why we want you to show your ID is because we want to make sure that we are giving vaccine to people who live in Orange County as well as work in Orange County. Sorry, I forgot that piece. So we are vaccinating people who live in Orange County, who live in, work in Orange County, regardless of what your status is. Let's repeat that. Regardless of your status, we want to make sure that you get the vaccine if you are currently qualified. And the qualification now is your healthcare provider and you are 65 and older. I want to make sure people understand that, okay?
Thank you, Dr. Chau. I think that's one of the main concerns that I always hear, especially now that I'm working with the Latino community, about the cost. And sometimes people think that they don't have insurance, and that's why they don't want to register. So they don't need to have insurance, correct?
Nope. No insurance required, nothing. This is free. Let me repeat that again. The vaccine is free for everybody who live and work in Orange County, okay? You're not reported to any agency. Your information is not reported. The state just want to make sure that we give the vaccine to people, okay? That's all there is to it, okay? So please, if you qualify, come out and get the vaccine.
Thank you. Well, we have less than 10 minutes, so I'm going to ask a couple more questions because we're still receiving a lot of questions. We might not be able to answer all of them. But the next one is, who is running the CVS Rite Aid vaccination sites? Should we go there instead of SuperPods?
Okay. So the federal, that's the piece of good news is that there are many ways a vaccine come to Orange County and there's access. The federal government just last Friday worked with in California, Rite Aid and CVS to give out vaccine to people who qualify based on our qualification, right? So in Orange County, the qualification is you have to be 65 and older, and you have to be a healthcare provider, okay? So you register through CVS, go to CVS website. I was told that there are 10 CVS sites in Orange County, and I believe we post those sites on our website, but you can go on to CVS website and find out which location, 10 locations in Orange County, and there are 30 locations of Rite Aid in Orange County that also offer vaccine, but based on Orange County eligibility list, okay? And so I know there are people who are able to get vaccine through Rite Aid and CVS. The number is small, but nevertheless, that's another venue for you to do so. Let me ask you, for the community to do this, if you register on Athena, and if you, by some chance, got the vaccine through CVS and through Rite Aid, do me a favor, go on to Athena and let us know that you already got your vaccine so we can open up the appointment for somebody else who might not have the vaccine yet, okay? But, right, those are the opportunity that the federal government worked directly with those pharmacies to also give access to vaccine to the individual county.
This is another question that I hear. Oh, go ahead.
That we do have some vaccine allocated through Cal Optima, who works through community clinics. I think we're doing 1,000 of those a day. And they also reach out to hard-hit populations.
Thank you. This is another question that I hear often. If I got my first shot in LA County, can I get my second in Orange County if I live or work here?
So I think that if you get your vaccine, wherever you get your vaccine for the first dose, try your best to get an appointment for the second dose there. But I know that because one reason or the other, sometime individuals who live in Orange County get vaccinated in other county, and if you are not able to get the second dose from out of this county, and you have proof that you are a resident of Orange County, we will try our best to get you the second dose. I don't want you to miss the second dose, right? But what we advise for folks to do is wherever you get your first dose, make sure you get your second dose there. So.
Perfect. If a person took the 2 vaccines and wants to donate blood, how long do they have to wait out after the second dose?
Ask that again, Martin.
If a person took the 2 vaccines and wants to donate blood, how long do they have to wait out after the second dose?
I think about a week, and you can donate blood. This is an interesting question. I have not come across it, but I imagine that after a week you can give your blood.
Okay. The next one is, why doesn't Orange County get more doses if we have so many residents?
That's a mystery to me. The state of California have 40 million people, right? The state of California have 40 million. Each week, the state only has 500,000 or a little bit more vaccine allocated to the state. And then the state have to divvy it up by 58 counties. So we are one of the few counties that have more doses than the rest of them. So usually the number one county that the most doses is LA, because they have more people than us. LA has 12 million people. And then secondly is San Diego, because San Diego has more people than Orange County, and we are third. So everybody wants more vaccine. The vaccine from the federal government to the state is limited as well.
Okay, this one, why can every county except Orange County have a drive-through for seniors 65 years plus?
We do. We started to have drive-through down in Soka for senior with mobility issues. We are testing out the Disneyland site for another drive-through opportunity as well.
If I can add, I was there at the opening of the Santa Ana College pod, and most of the people that they were getting their vaccine, it was a drive-through over there, and people were very happy. Most of them, they were saying it was less than 10 minutes.
Yeah.
Okay, we have 3 more minutes, and I have one more question before we say goodbye. How many volunteers does the county have to help with vaccines? Is it enough? How many more do you need?
Well, it's never enough. You all know that we appreciate volunteer, but volunteer have different schedules. And so we're juggling with having enough people to cover all the shift. And so if you're willing to volunteer, please contact us. We need all the help that we can get.
Thank you. Questions? We're getting more questions. How can nursing students get vaccinated? We have direct patients contact and hasn't been offered through our schools.
Yeah, so when the school, like I said, when educators are eligible, that's where the student will be eligible, I believe.
Dr. Chau, I received a question here. How long do we have to wait if we have COVID to get vaccinated? How does that work when you get sick and get vaccinated, or should you?
So the recommendation now is because we have limited amount of vaccine that the CDC recommend that because we have limited vaccine, that if you're positive or you've been sick with COVID, that you could wait up to 90 days before you get the vaccine. But when we have plenty of vaccine, then the CDC recommend that people get vaccinated 14 days out of when they tested positive or when they got sick, right? So there's a first 14-day window that you should not get vaccinated. But because the limited vaccine is safe, I'm going to put that in quotation mark, for you to wait up to 90 days before you get the vaccine.
Thank you.
Dr. Chau, before I go to the next question, also, can you clarify, because some of the people, they don't understand that the county doesn't get 100% of the vaccines?
Sorry.
I mean, about the number of vaccine or the percentage of the vaccine that the Orange County government gets and the rest goes to the private providers. Can you clarify that?
Yeah, so the states send vaccine to what we call multi-county entity, like UCI, like Kaiser, and also Providence. So they get allocated directly from the state, and then the state turn around and allocate to the county and certified providers. And so we work with a certified provider like community clinic and some of the other hospital to ensure that they have the vaccine to vaccinate the healthcare provider. Remember, this whole process just started 2 months ago, right? And up until now, we've been vaccinating all the healthcare provider. And by the way, in Orange County, there are well over 200,000 healthcare provider who live here, but that's not counting healthcare provider who come and work here, but live in other county. And so the number is larger than 200,000, and we have not had enough vaccine to take care of them. And then the 65-year-old and older, which have just we added about a month ago. And so there are 500,000 or more 65 and older in Orange County. So again, back to, we have a large bucket of people, but we have a very small access of vaccine, okay?
I think we have like 15 more minutes before we finish this, so we have more questions. The next one is, how can immunocompromised seniors get a drive-through vaccine? Is it possible if I don't have a handicap placard?
So currently we are not vaccinating people with immunocompromised individual unless you're 65 and older. And so I would imagine that you could get a letter from your treating provider proving that you are immunocompromised. And let's see if we could get you through the drive-through.
Thank you, Dr. Chau. Vice Chairman Chaffee, would you like to add closing remarks before we say good night?
Well, I think closing remarks, I have to start with a thank you to so many people that are working so many long hours. Our incident management team goes 7 days a week to make certain that all of our pods are staffed and have adequate supplies, not counting not having enough vaccine, which is not within their control. But one of the major efforts, as Dr. Chau pointed out, has been to get our healthcare providers. They're most exposed. They are working with people who have the virus. We need to get them vaccinated. And then the vulnerable population we have is our senior group. And I understand that about 2/3, or maybe even more than that, of the deaths, 75% of them are from people that are 75 years or older. And in our intensive care hospital units, about 2/3 are 65 and older. So it's important that we get to that population. When we do that, it helps us with our metrics. It helps us protect the others in the county and get us closer to reopening and getting the economic ship righted when we can. So in particular, I want to also thank to some of our cities that have let us to have some of their paramedics from their fire departments to come in and do the vaccination for us. We need specific kinds of people to help us, and when they allow us to use that resource, it's been very helpful. So I would say that the county has established what we call Operation Independence, which is a goal by July 4 to achieve and complete all the county vaccinations that we can do, where we have at least achieved what we call herd immunity. But this can only happen if we work together and reach out everywhere we can, because the hard to reach communities, not only do they have serious complications within their communities, but can infect the rest of us too. So the effort has been to go to the hardest hit areas to solve that as best we can. And so many people have been reaching out to help. It's just really uplifting to see that work. So thank everyone for listening tonight, and thank you, Dr. Chau, and thank you, Martin, for helping with this forum this evening.
Thank you. Dr. Chau, would you like to add something else?
The only thing I'm asking is, regardless of whether or not you have gotten the vaccine, please continue to wear the mask. Stay home if you sick. Don't gather, and stay 6 feet apart from people who you don't know, and wash your hands frequently. So thank you, and good night.
Thank you, Vice Chairman Chaffee and Dr. Chau, for your participation and information in this virtual town hall. Please be informed and stay healthy. Your health is what it matters. Good night.